So side effects of Accutane. Let me tell you about them. I'm a board-certified dermatologist. I put patients on Accutane every day. This is isotretinoin, and this is the treatment for severe acne. The first thing that people usually notice when they're on Accutane is dry lips. In fact, if you don't see dry lips, you might not be absorbing the medication, or maybe you're even skipping it or forgetting it. You might even experience some dry eye. Most people just take care of these symptoms with a little bit of Vaseline, humidifying their home, using eye drops, and they're fine. Depending on the weather, you might experience dry skin as well and a little bit of an eczema flare. And once again, this can also be treated, just topical preparations and skincare. Another thing people on Accutane might notice is that their skin is more sensitive. They're not going to be able to get their face waxed, otherwise it's going to get burnt. They're not going to be able to spend a lot of time in the sun because they will get sunburnt as well. As your isotretinoin dose increases, some people experience mild fatigue, some musculoskeletal aches, but usually that's pretty manageable. We're also checking blood work every month. What we're looking for is we're making sure your liver is okay. We're measuring your cholesterol and your triglycerides. Those usually increase a little bit, but there's not too much cause for alarm. We just trend them up and make sure they don't go too out of whack. As we increase the isotretinoin dose, some people do experience anxiety and depression. The nice thing about Accutane or isotretinoin is that all doses improve the skin. So since side effects are dose dependent, you can still decrease the dose and still see a really great improvement in your skin. So a lot of my patients who experience a little bit of anxiety or depression, usually it's anxiety, I just decrease the dose and they do just fine. We also ask patients about changes in vision while they're on Accutane, because that would be something that we would want to stop the Accutane if that's happening. If mixed with other medication, Accutane can cause something called pseudotumor cerebri. This is an increase in intracranial pressure, which causes a really bad headache, and that's an emergency. You need to go to the ER for that. So that's why we ask people not to mix it with other medications. Accutane can also cause birth defects. Now, how does it do this? Accutane is basically high-dose vitamin A. Vitamin A is something that the embryo uses, and it turns it into basically a signal telling the embryo which way is up. And the embryo folds in accordance to the gradient of that signal. So obviously, if you overload this signal, you get structural problems. The embryo does not form correctly. That's why if you're on Accutane, you should not be conceiving. You shouldn't be giving blood in case that blood goes to someone who is pregnant. And if you want to get pregnant, you should wait 1 month after your last dose. By that time, the Accutane is fully out of your system and you're not going to have any problems. Even though usually for acne, we want to do a full course of Accutane and we want to try to get the patient to a certain goal dose, you can use low-dose Accutane for a lot of different things. Sometimes it's for rosacea or rhinophyma to shrink the nose. You can use it for sometimes sebaceous hyperplasias. Those are overgrown sweat glands. You can use it for the pimples that go into the scalp. That's called dissecting cellulitis. So story time, I had a patient once with adult onset, new onset rosacea rhinophyma. He was breaking out in pustules. His nose was getting larger. He was absolutely miserable. He had gone from doctor to doctor to doctor. I finally told him, I really think that you need Accutane, but he was scared of the side effects. But his rosacea was really getting out of hand. He was absolutely miserable. He was avoiding social situations. He was not going out. He was depressed. His skin embarrassed him, and his quality of life went down. So I told him, I really think you need to go on this. We'll keep the dose low. The side effects should be minimal, and we'll keep a very close eye on you. He finally agreed to get on the low-dose Accutane, and I have never seen someone happier. His skin cleared up, his nose shrunk, he felt handsome again. He was smiling when he came in for his follow-up visits, and he's on a very low dose, and I'm keeping a very tight watch on his labs. He does have some other pre-existing medical conditions that we talked about, but he was not living before when he was not on the Accutane. And with every patient and with every treatment, there's a risk-benefit ratio that we have to talk about. But we really talked about quality of life with this particular patient because, even though he had some other issues going on, like, high cholesterol and other things, he was not living his life. He was depressed. And really the risk was worth it because he got his life back. So I hope this video touched upon all the side effects that I usually see with Accutane. Usually people are very, very happy on it because their skin definitely gets better. Drop any questions you may have in the comments.